Turning now to the latest on the coronavirus, here's a look at the line for COVID-19 testing in the DHEC parking lot on Bull Street. You can see it stretched around that parking lot and circled it earlier today. This comes after the agency reported over 8,800 new cases across our state on Friday. That's more than has ever been reported here since the pandemic began. Hospitalizations are also on the rise, more than doubling in the last weeks, including people on ventilators and in the ICU. While they work to add more testing sites and increase capacity at existing locations, there is concern tonight about what the New Year's holiday could mean as millions of travelers return home.
This is no time to mince words. This is flat out alarming for our state. We recognize at this point that people are numb to the data, but these stats aren't simply numbers. They represent people. They represent people who are our family members, our friends, and our loved ones who are sick, who are hospitalized, and unfortunately, some of whom are dying from this disease.
Well, much of the surge in new cases has been fueled by the new Omicron variant, but health officials say it appears to be less severe than previous strains. DHEC is encouraging those with mild symptoms to take care of themselves at home to avoid overcrowding the ERs, which are becoming overwhelmed in part by asymptomatic people seeking COVID testing. South Carolina health officials are warning that you might have to wait a while to get that COVID test this month. Some testing sites across the state have times between 30 and 45 minutes at peak hours, but officials with DHEC say in the next few weeks you might be waiting an hour or two. Well, the CDC recommends a test if you have COVID symptoms or if you've been exposed to someone that is positive. If you are experiencing mild symptoms, Dr. Todd Crump with Lexington Medical Center shared some ways to cope from home.
Aren't having any difficulty breathing or catching your breath, I recommend trying an over-the-counter antihistamine or some Mucinex, and usually symptoms resolve in a couple of days.